Hi everyone, today we are going to see about the cranial nerves. There are 12 cranial nerves. For any cranial nerve, you have to know the origin, root, relation, branches, and the functional components of each nerve. Today we are going to see the seventh cranial nerve, which is your facial nerve. Facial nerve is a mixed nerve, that is, it contains motor, sensory, and parasympathetic fibers. Coming to the functional component, for motor or muscles of facial expression, supplies stapedius, stylohyoid, and posterior belly of digastric. Coming to sensory, taste from anterior two-third of the tongue via chorda tympani, and general sensation from a small area of external ear. And parasympathetic to your lacrimal gland, submandibular gland, sublingual salivary gland, and nasal and palatine glands. Now coming to the root and origin of facial nerve has two roots. The large motor root, which is facial nerve proper, and a small sensory root, which is also called nervus intermedius. It is an important viva question. The sensory root of facial nerve is called nervus intermedius. Both arise from pontomedullary junction lateral to superior olive. The sensory root lies between the motor root and the vestibulocochlear nerve, which is your eighth cranial nerve. Sensory nerve lies between the motor root of facial nerve and eighth cranial nerve through the cerebellopontine angle. After leaving the brainstem, both roots passes laterally and forward through cerebellopontine angle, which is very important, along with your eighth cranial nerve, which is your vestibulocochlear nerve and labyrinthine artery. It enters the internal acoustic meatus. So in the internal acoustic meatus, you have seventh cranial nerve, eighth cranial nerve, and labyrinthine artery. It is also another important viva question. Inside the internal acoustic meatus, the motor root sits in a groove on a vestibulocochlear nerve, while the sensory roots stay separate until they unite in the bottom of the meatus. So in the internal acoustic meatus, both the motor and sensory root divides. Okay, this is where the facial nerve enters the facial canal in the petrous of temporal bone. Temporal bone is around your ear, it's above your ear. You have a temporal bone. Okay, the facial nerve enters the facial canal, which is in the petrous temporal bone. Now coming to the three segments of facial canal, you have labyrinthine segment, tympanic segment, and mastoid segment. Labyrinthine segment lies above the vestibule of bony labyrinth. It bends sharply backward. This bend is the external genu and holds the geniculate ganglion. This is an important thing. In the labyrinthine segment, you have an external genu and it has a geniculate ganglion. Now coming to tympanic part, it runs horizontally along the medial wall of middle ear. Tympanic segment runs horizontally along the medial wall of middle ear until it reaches the junction of medial and posterior wall of the middle ear. So middle ear, you have 6 walls, which is anterior, posterior, upper, lower, and medial lateral. Okay, its bulge is seen above the promontory and below the lateral semicircular canal. And coming to mastoid segment, it begins at the junction and runs vertically downwards through the posterior wall of middle ear, ending the stylomastoid foramen where the nerve exits the skull. So you have to know the three segments. One is labyrinthine, tympanic, and mastoid. In the tympanic segment, it runs horizontally, whereas in the mastoid segment, it runs vertically. Coming to branches, you have greater petrosal nerve, now to stapedius, chorda tympani, greater auricular nerve, now to posterior belly of digastric, now to stylohyoid, and 5 terminal branches. Greater petrosal nerve supplies lacrimal gland, nasal and palatine mucous gland via pterygopalatine ganglion. The nerve supplies the lacrimal gland, nasal and palatine mucous gland through greater petrosal nerve, which is a branch of facial nerve. and nerve to stapedius supplies stapedius muscle, and chorda tympani gives taste sensation to anterior two-third, only anterior two-third of the tongue, which is an important question, and it also supplies submandibular and sublingual gland. Then posterior auricular nerve, after coming through stylomastoid foramen, it supplies occipital belly of occipital frontalis, and nerve to posterior belly of digastric, it supplies the posterior belly of digastric, and nerve to stylohyoid supplies us the stylohyoid muscle. And after coming through stylomastoid foramen, there will be 5 terminal branches. On passing through the parotid gland, the facial nerve pass through the parotid gland and gives away 5 terminal branches. They are temporal, zygomatic, buccal, marginal mandibular, and cervical. If they ask the 5 motor terminal branches, this will be the 5 motor terminal branches. One is temporal, zygomatic, buccal, marginal mandibular, and cervical. You can remember with the mnemonic 10 zebras bite my cat, which is your temporal, zygomatic, buccal, marginal mandibular, and cervical.